A dobutamine stress echocardiogram, or DSE, is a vital diagnostic tool used to assess aortic stenosis, a condition characterized by the narrowing of the aortic valve. DSE is particularly useful in certain clinical scenarios, providing critical insights that guide the management and treatment of this condition. In patients with aortic stenosis, especially those presenting with symptoms but showing a low mean gradient across the aortic valve and a low ejection fraction, it can be challenging to determine whether the stenosis is truly severe or if the low gradient is due to reduced cardiac output. This is where DSE comes into play. By increasing myocardial contractility through the administration of dobutamine, DSE helps to differentiate between true severe aortic stenosis, which is characterized by fixed, severe valve narrowing, and pseudo-severe aortic stenosis, where the stenosis appears significant due to low cardiac output but may improve with increased contractility. This differentiation is crucial for accurate diagnosis and treatment planning. Contractile reserve refers to the heart's ability to increase its stroke volume in response to stress, such as that induced by dobutamine. In patients with low flow, low gradient aortic stenosis, and reduced left ventricular ejection fraction, DSE is used to assess the presence of contractile reserve. The presence of contractile reserve is a favorable prognostic factor, indicating that the patient may benefit from aortic valve replacement. Conversely, the absence of contractile reserve suggests a higher risk of poor outcomes and may influence the treatment strategy, possibly leading to more conservative management. In some cases, non-invasive tests like transthoracic echocardiography may provide inconclusive or borderline results regarding the severity of aortic stenosis, especially in symptomatic patients. DSE can be used in these ambiguous cases to provide additional hemodynamic information. By evaluating the heart's response to the increased workload induced by dobutamine, DSE helps to confirm whether the stenosis is moderate or severe, which is crucial for making informed treatment decisions. For patients with significant aortic stenosis who are being considered for non-cardiac surgery, particularly those with reduced ejection fraction, DSE can be an essential tool for preoperative risk stratification. By assessing the severity of aortic stenosis and the presence of contractile reserve under stress conditions, DSE helps determine the patient's surgical risk. This information is vital for guiding the decision-making process regarding the timing of aortic valve intervention relative to non-cardiac surgery. In patients with severe aortic stenosis who are asymptomatic, DSE can help assess the risk of future events by evaluating the heart's hemodynamic response to stress. Identifying reduced contractile reserve or other abnormal responses during DSE in asymptomatic patients might suggest a higher risk of progression and can influence the timing of aortic valve replacement, even in the absence of symptoms. In patients with a bicuspid aortic valve, particularly those with unclear severity of stenosis or reduced left ventricular function, DSE can help determine the functional significance of the valve stenosis. This assessment is crucial for deciding whether surgical intervention is necessary, as bicuspid aortic valves can have variable degrees of stenosis. In conclusion, the dobutamine stress echocardiogram is a valuable diagnostic tool in managing aortic stenosis, particularly in complex cases where the severity of the stenosis is unclear or when left ventricular function is impaired. By providing dynamic assessment under stress, DSE helps clinicians make informed decisions regarding the need for and timing of interventions like aortic valve replacement.